Hello, I'm Ed Rubenstein, Director of Environmental Compliance, Energy, and Sustainability at the University Health Network. The Energy and Environment Department has worked on a couple of projects at UHN's operating rooms. One of them was around waste, where we implemented a recycling program in the suites, where all of the materials collected during preparation for a case would be recycled if possible and taken out of the room. So there's a misconception that operating rooms are not eligible for recycling because of the nature of the work going on. But in reality, there are a lot of separate materials, packaging, and things like that. Many of them sterile, which can easily be diverted through existing recycling programs. So there's a lot of waste coming out of operating rooms and also a lot of opportunities. And I should say great opportunities for waste reduction as well. So recycling is great, but if we can reduce wastage, overage, things like that. Hard cases instead of soft packaging for sterilization. A lot of opportunity as well in terms of waste reduction. So when it came to setting up a recycling program in our operating rooms, we had to work with clinical staff to understand what types of waste were being generated, preparation of case, the workflow, and things like that. And then we worked with our waste haulers to identify which of these materials were able to be recycled with our current contracts. Once we had established that, again, we went back to some of the clinical staff and said, what's a good workflow? How can we make this work? Making sure that we involve our infection control, safety services, and obviously the nurses and doctors and all the allied health staff, anyone involved in a surgery, to make sure that we gave them the tools they need so they can recycle properly, safely, and in compliance with UHN's waste and recycling policies. So before we had recycling in the operating room, all waste, be it clean, sterile waste, packaging, and things like that, was going to garbage. After we had this recycling program, anything that could be recycled was being diverted and sent out through the hospital's existing recycling programs that we had implemented in other areas of the hospital. There was a bit of a misconception that the operating rooms could not recycle, but again, working with stakeholders and identifying what we needed to do, it was pretty straightforward once we had an idea of the barriers that we had to overcome along the way.